Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Over the years, various studies have investigated the role of antioxidant supplements with respect to their ability to reduce heart attacks and cardiovascular disease. Now, experimental studies and human observational studies suggest that antioxidants such as vitamin E and vitamin C and beta-carotene can actually reduce risk of heart attacks and circulatory problems. Now, these antioxidants reduce free radical damage to the bad cholesterol, the LDL cholesterol, which makes this form of cholesterol less inclined to stick to the walls of the arteries and cause narrowing or atherosclerosis. And we know that cholesterol-clogged arteries are a major risk factor in many cases of heart attack and stroke and can cause other circulatory problems to the feet and the kidneys and the eyes and other tissues. However, human clinical studies using antioxidant supplements to prevent heart disease have not shown convincing results so far. But a study published in the American Heart Association journal Hypertension in April of 2018 has shown that the antioxidant supplement known as coenzyme Q10 significantly improved vascular function in healthy older subjects. So according to the researchers, a novel form of CoQ10 called MitoQ reversed vascular changes by the equivalent of 15 to 20 years in those older subjects after taking CoQ10 for just a 6-week period at a dose of 20 milligrams per day. Now, by comparison, those taking the placebo experienced no improvement in vascular function. So here's how the researcher Dr. Rossman explained the remarkable reversal in vascular function produced by CoQ10 supplementation in this study. He said, the researchers found that when taking the CoQ10 supplement, dilation of the subject's arteries, or opening up of the subject's arteries, improved by 42%, making their blood vessels at least by that measure look like those of someone 15 to 20 years younger. This is the reversal now of age-related changes in the artery wall. He said that an improvement of that magnitude, if sustained, is associated with about a 13% reduction in heart disease, according to the study researcher Dr. Rossman. Now, the study also showed that the improvement in dilation, or opening up of the blood vessel wall, was due to a reduction in free radical damage, or oxidative stress, as we call it. As Dr. Rossman explains, blood vessels grow stiff with age. Our blood vessels get more rigid, largely as a result of oxidative stress and the excess production of metabolic byproducts such as free radicals, which can damage the inner lining of the blood vessels and impair its function. You see, during our youth, our bodies produce enough antioxidants to quench these free radicals. But with age, we make less of these antioxidants, particularly coenzyme Q10, and the balance tips as mitochondrial and other cellular processes produce excess free radicals, and the body's antioxidant defense system cannot keep up. Now, it's known that CoQ10 is an antioxidant that quenches free radicals in the area around the cell's mitochondria, the energy factory, which is an area of the cell where many free radicals are generated. It's also well documented that the body's CoQ10 synthesis declines with age, which decreases the body's ability to quench free radicals and also to generate energy. As well, previous studies have shown that CoQ10 supplementation improved blood circulation in the arteries of diabetics by increasing the release of nitric oxide from the artery wall. So the lining of arteries normally secrete nitric oxide to dilate or open up their blood vessels, helping to prevent heart attacks and to maintain more optimal circulation. So in the study in the journal Hypertension, researchers used a novel type of CoQ10 called MitoQ, which targets the mitochondria specifically, so I think it's worth keeping an eye on future studies using this form of CoQ10. In the meantime, most anti-aging experts suggest taking at least 30 to 60 milligrams of coenzyme Q10 per day after the age of 40 or 45 to help compensate for what the body doesn't make for itself anymore, and to help preserve cellular energy production and maintain antioxidant function and quench free radicals. And together, these things may possibly help prevent congestive heart failure, high blood pressure, and possibly Parkinson's disease as one ages. So I've included the research article reference in the text below, along with a couple of links to other impressive CoQ10 research studies that you may find to be of interest. So thanks for watching, and I'll see you next time.